am Dr. Vishwanath Gauraya. I am consultant pediatric pulmonologist. Today I am going to talk about snoring in children. So what is snoring and when the parents need to worry about the snoring, and what are the groups of children who have more problem if they are snoring, and what the doctors are going to do, how to assess the issues with the snoring. To start with, what is snoring? Snoring is the noise, harsh noise which we all generate when we sleep. That so happens because this part of the body, what we call as pharynx, this is the area which is made up of muscles. These muscles will relax in all of us, both the children and adults, when we are sleeping. So the air which moves in and moves out of this area which is relaxed makes the noise. So when the child is snoring, almost 15 to 20% of the children do snore normally. So it is a common issue. So of this, 3 to 4 children will have a problem because when their muscle is so relaxed, they struggle to breathe and they actually stop breathing at the time for a few seconds, maybe 10 to 15 or 10 to 20 seconds. So at this time, the concentration of the oxygen in the blood goes down, and hence the blood supply to the all part of the body, like the vital organs, mainly the brain, which is still active in the children when the children are sleeping, and other part of the vital organs of the body like the heart, lungs, the liver also will have a low oxygen supply. So because of this, the child's both the mental and the physical health will suffer if we have not looked after these kind of children. So they normally don't present as a complete stopping in the breathing like in adults. However, they will have more problems in the daytime. Say for example, they struggle to wake up in the morning and they want to sleep. They don't want to get ready to the school, and they do struggle in the school with the lack of activity or lack of concentrating on what the teachers are telling. Usually teachers pick up these kind of children, tell the parents that your child is either lack of concentration in the school, not learning as compared to other children, and is feeling sleepy in the daytime and don't want to participate in the activity. Or they will be very irritable. They are having behavioral changes compared to other children or compared to their own standards as before. So these are the main things what you as a parent or as a teacher will notice and let the parents know. So these are the symptoms which we need to worry about, saying they may have a problem with the sleep. And some children can have a bedwetting which starts again once they have attained control of the bladder. So these are the patients you need to worry about. And there are certain group of children who definitely we need to worry about when they are snoring, are one, the children with the allergies and asthma, the children who are obese and who have constant or the repeated viral infections, because the tonsils and adenoids will go up in size and the airway is relaxing, and the tonsil and adenoids are also pressing on the airway. So these are the group of the children. Some children with the genetic conditions such as a neurological problem where the airway muscles will relax more, and the children with the Down syndrome, for example, who have a low muscle tone to start with, so they will have more problem when they are sleeping. And overall these sleeping issues cause the low level of the oxygen in the blood, which will be supplied to all the vital organs, which impact on the development, both the physical and the mental development of the child. So what does the doctors do when the children having the snoring issue, or possibly they are stopping to breathe? So we do a study, what we call it as a sleep study. It is mainly looking into the brain wave pattern in the child to look at the sleep stages to make sure they are having a good quality of sleep. And then we monitor the oxygen level in the blood, the heart rate, the leg movement, because many of these children who snore will be thrashing around in the bed and they won't be fresh in the morning. Then we also look at the snoring pattern, how they are snoring or whether they are stopping to breathe. So these are the things we monitor, and then we look into all the picture what they do in the night time, and then we will make assessment with what type of help this child will need, and we will be able to counsel the parents. So in bottom line, or in summary, snoring is common, but the snoring can have an impact on the oxygen level in the blood, which can have impact on both the development, the physical and the mental development of the child, which needs to be assessed appropriately by a trained doctor who can look after children with the sleep problems. Thank you very much.